Hello and welcome to my study on toileting, an increase in successful urination using underwear for children with ASD. Today I'll be discussing how the use of regular underwear can increase successful urination and promote toileting independence in a child with ASD using ABAB design. Toilet training for children with ASD can be particularly challenging. Things like sensory sensitivity, communication difficulty, and/or other developmental factors. Traditional methods such as training pants or pull-ups may not provide the necessary feedback that children need to recognize their body's cues for toileting. So in this study, I aim to explore whether using regular underwear instead of training pants or pull-ups would lead to an increase in successful urination and better toileting behavior in a child with ASD. The study used an ABAB design, which involved alternating between baseline phase and intervention phase multiple times to assess the effectiveness of the intervention. We observed one child diagnosed with ASD, age 4, over the course of 8 different phases, 4 in baseline and 4 in the intervention. In each baseline phase, the child used pull-ups as he was, and in the intervention phase, regular underwear was introduced. The phases alternated as followed: A, B, A, B, A, B, A, B. During each phase, data was collected by observing the child's successful urination, accidents, and self-initiating toilet behavior. These observations allowed us to assess the effectiveness of the underwear compared to pull over multiple cycles. The results are very telling. During the intervention phase, when the child used an underwear, there was significant increase in successful urination and noticeable reduction in accidents. In contrast, during the baseline phase, the child used pull-ups, there were 0 successful urinations and there were more frequent accidents. These repeated observations across 8 different phases, A, B, A, B, A, B, A, B, allowed us to clearly see the positive impact of underwear intervention as the child's toileting behavior improved during the B phase and worsened to 0 during the A phase. These findings suggest that underwear, by providing immediate sensory feedback, can be an effective tool for promoting successful toileting behavior and increased independence in children with ASD. The ABAB design allowed us to consistently observe the changes in behavior across multiple cycles, reinforce the effectiveness of underwear in facilitating better toileting awareness and independence. This design also helped us confirm that the observed improvements were due to the intervention rather than other factors. So in conclusion, using underwear for potty training can be a more effective and practical strategy for children with ASD, fostering both independence and awareness. The ABAB design demonstrated the effectiveness of underwear intervention, showing a clear, repeated pattern of improvement in the child's toileting behavior. Further research with larger sample sizes and further exploration of sensory feedback during potty training will be a valuable asset in confirming these results and understanding long-term impacts. So thank you for listening to my study, and I look forward to continuing this research and contributing to the field in early intervention with children with ASD.